like
very matter-of-fact way.
Social situation.
Exactly.
Okay.
To find out what the social at home, what the quality of marriage and other relationships is, to ask them about that, and then take the lead from the patient. Because if the patient really wants to discuss it more, they'll probably give the physician a lot of information about that, and particularly their attitudes on how they view spiritual practices and spirituality will affect their health and well-being.
That's good advice. We do have another caller. Good evening, and welcome to Medicine in the News.
Yes, my question to you, Mr. That's yoga you're talking about. I mean, they have practiced this in China with the Buddhists, Dalai Lama, and all those people. Basically, that's just coming to the Western world, but as far as using meditation, concentration, and that's yogaism. And they always have associated the two. They use it for medical health, and they also use it to overcome addiction with the 12-step program that Buddha teaches and whatnot.
I think the caller's making a good point that there's cultures all over the world that are probably way ahead of us in terms of using these techniques.
Well, that is absolutely correct. It's yoga and whatnot, and they've always did these things. The Dalai Lama is a good example of that type of thing that the gentleman is talking about as far as addiction is concerned. Abstention through meditation, concentration, it wipes that out, and that's the only way. There is no other way to treat desire, because desire is within the individual. And in order to eradicate the desire, if you're treating it with methadone or lamb and all them other things, you're just helping them to manage the problem. But basically, what the gentleman there is describing from the books that I read on yogism and things of that nature, that it would be better to refer them to yogism, to yoga, and Buddhism and things of that nature, Taoism and all those things. These are the things that they practice rather than just medicine alone to heal the body.
That's again, appreciate the call, and it sounds like the caller is referring to that link now that Western medicine is finally meeting Eastern medicine.
Right.
And is that?
I think that caller has a lot of wisdom. I think he brings up an important point, and that all religions, Judeo-Christian religions, Eastern religions, and Mideastern religions, have a spiritual perspective, and that healing ultimately takes place on the level of the spirit. That we need physical interventions, we need social interventions, we need support, we need to live healthy lives. But the compulsion and the obsession to use drugs gets lifted through relationship with higher power, through cultivating the spirit. And I've heard this described all the time by individuals in recovery, that it's something that happens in an effortless way when one devotes oneself to a spiritually oriented recovery program. And it's been most studied in addictive diseases, and there's research saying that it can happen in a variety of other, particularly chronic diseases.
That's great. Well, we do have a few other callers. Good evening. Welcome to Medicine in the News.
Hello, my name's Mike. I have 38 years in addiction, then I hit bottom, went into AA, then I surrendered to the spiritual part of the program. And I've had a good life for 13 and a half years. I've got no complaints.
Do you think that the spirituality, the component of AA played a part in that?
Oh, yeah. The spiritual part is just tremendous in my life. And I've misused everything in my life for 38 years. I had no life. And when I went into AA, I hit bottom. I come off the street and went in and sat there for a year and didn't get nothing out of it. Then I surrendered to the spiritual part, and I've had a great life ever since. And I got no complaints of what life's about today. And it's all because of the program, because there is a higher power. And I choose to use God, because He does work. He works in people's lives. I've seen it. I've been around a long time in the program. I got a good life.
It sounds like you're talking about having an awakening, which is what our guest, Dr. David O'Connell's referring to.
I was going to say the same thing. This individual obviously had a profound transformative experience, had a spiritual awakening, came to function differently, realized that there was a whole life beyond drugs. And they have inner serenity, and there's a certainty about this. When one has a spiritual awakening, it's not something anybody else can prove to you. You know it inside. It's a change from the inside out. And everything's different. You think differently, you feel differently, the senses take in information differently. It is really a second birth. It really is waking up in a permanent way to another reality, to the reality of serenity. And it's very inspiring to hear this caller very matter-of-factly say, that's what happened to me. So a serious, debilitating, potentially life-threatening drug addiction can almost evaporate through involvement in spiritual program.
Great. Well, we appreciate the call, and that leads in again just to touch base about the book, Awakening the Spirit, because I think viewers out there are interested in this topic and are wondering how they can get more involved in this and really find out about this topic. It's a good book, and of course we have the resource, the author, right in our community. And actually, if we can, do we have the graphic of showing the information about where people, thanks for that, and if people are interested, they can go to this website and find out about getting the book, because it sounds like we have people out there who'd be interested in that. In the meantime, I believe in our last minute or two, we do have another caller. Good evening, and welcome to Medicine in the News.
Good evening. I just wanted to ask the host to have Dr. O'Connell on again, because I happen to be in recovery for many years, went to the foundation, and it's been a long time since I've heard anybody explain it as good as he explaining it. And I would really like you to talk about the concept of the disease, because the denial in the medical profession, I mean, is unbelievable. Some of these doctors still don't want to accept that, you know. And I think you and I, Dr. O'Connell, will be meeting in the future. But anyway, I wish you would have him on again a little bit longer, because it's unbelievable the way he's explaining it for the people out here.
Well, hey, that was very nice to hear that. I'm glad it was so articulate and so clear for you. And certainly addiction is a disease, and it's recognized as such by the American Medical Association, World Health Organization, and it's not just a weakness or a character defect. It is a physiological disease that seems to respond best to a spiritual program.
Right, and with that, we're going to wrap it up. This has been Medicine in the News. I'm your host, Dr. Lee Radosh. Again, I thank Dr. David O'Connell, psychologist from the Caron Foundation. As always, we just scratched the surface, unfortunately. But again, thanks for joining us this evening, and have a good evening.